Greetings and welcome to another episode of Going All In, Get the Edge You Need to Succeed. I'm Dr. Erin McKinley, and today we have another awesome spotlight session with Dona Greenwood from the Keiser University, Masters of Science in Nutrition with Distance Learning Internship, with their offices based in Fort Lauderdale, Florida. All right, welcome to the podcast, Dona. To get us started for this episode, I would love for you to give us an introduction to you, your journey to where you are today, and how you landed with Keiser University.
Oh, thank you so much. Let me tell you a little bit about me. I am a registered dietitian. I am a licensed dietitian also in the state of Florida, and I am the program director for Keiser University, Master of Science in Nutrition with Distance Learning Internship. How did I get here? Well, my journey began, I was a little bit of a late bloomer going to college. I actually got promoted in industry to a position I didn't want and decided it was time to go to college. Always wanted to be in food service, started in food service management, and the second semester I went ahead and changed to dietetics and nutrition. I got my bachelor's from Madonna College in Michigan. I have my master's of education from University of Central Florida, and my doctorate is a PhD in biological sciences with a concentration in nutrition from the University of Surrey in England. How did I make it to England? Well, I started out on Friday, I ended my internship. On Monday, I was the clinical manager of a 1,200 bed facility. I stayed for about 10 years in management. And during that time, I had no pediatric RD. And so I had to take over pediatrics. When I left the hospital, I completed the 2 fellowships in pediatric, one in pulmonary nutrition at Shands Hospital in Gainesville, Florida, and the other one, the neonatal fellowship at John Riley Children's in Indianapolis, Indiana. So for about 5 years, I actually had my own company where I was doing pediatrics. I did specialty peds and I did child abuse peds. I was reading a journal article where a university in England was looking to put together an international study in pediatrics. So 3 phone calls later and 4 days of interviewing, and I actually had to represent my thesis. I was the American candidate that they took into the program. All of our studies centered around pediatrics. I looked at pediatrics more from a psychosocial and environmental influence, saying that when you use the term failure to thrive, it is the same as protein energy malnutrition, and we masked the prevalence of this in England. Let me just share my final exam with you. It's done a little differently in England. I had the health minister of Scotland as my external. External meaning he reviewed my paper and then asked me a series of questions. Now, he was a medical director and a good friend of my advisor. 4 hours later, he went page by page of my dissertation and questioned you couldn't even begin to believe. After 4 hours, we had a 15-minute break. And would you believe he came back and went page by page again? And he got to a page where he disagreed with me. And he said, you must change this word synonymous. They are not the same. I am a medical doctor. And I sat for a minute and said, I can't. This is the basis of all my work, and I stand behind it. So I said to doctor, I said, I'm sorry, sir, I can't agree with you. He hesitated for a minute and he said, Dr. Greenwood, went completely over my head. He looked at me again and he said, Dr. Greenwood, and in front of the health minister of Scotland, I cried like a baby. And that's how I got where I am. Since 1986, I also have been teaching, whether it was adjunct or full-time. I have taught at the community college level and I've taught at the university level. I have also been a program director for all the different routes there are towards becoming a registered dietitian. And I consider myself honored to have filled these positions. So let me tell you a little bit about the program we have at Keiser, because it's unique. All right, why are we unique? Well, we are a Master's of Science in Nutrition with a distant learning internship. We do have full accreditation from the Academy for our dietetic internship. And that, if you know anything, is quite a privilege for us to have and maintain. We are fully online, both the didactic coursework and the internship. We are not a hybrid. So we take students from all over the United States to form our cohort because we are a fully online learning program. The best part of our program, we are done in 1 year. You will receive a Master's of Science in Nutrition and also complete the dietetic internship in 1 year. And how do we do that? Well, we're able to do that because the Department of Education, as well as our regional accreditation agency and ASCEND, allowed us, based on the assignments in the internship, to award those credit hours towards the master's program. So a student is taking didactic courses as well as in the internship, the assignments are of graduate standards and must meet graduate standards in grading. And that's how we were allowed to create a Master's of Science program in nutrition with a distant learning completed in 1 year. So you can imagine it's a pretty rigorous program, but we have 100% retention rate with our program. Another factor that's important to know is you can complete our program geographically in your own area, anywhere in the United States, or a territory of the United States. So students can begin their program in one area, maybe have to relocate, and they can complete their educational program that way. You are not limited to just staying in your geographical area. We often have students that relocate because of family members. Many relocate to Florida because we are based out of Florida and stay with grandma and grandpa while they're finishing their internship. So you have that flexibility of mobility, but also if you stay in your geographical area, you don't have the cost of relocation. We also encourage our students, and we encourage to always be in communication with our students. We have bi-weekly individual calls to our students, as well as the following bi-weekly meetings. We bring guest speakers in through Zoom. The two cohorts come together and they get to know each other. And it serves as a very positive mentoring for both cohorts that are going through the program. Probably one of the questions that our students are asking is tuition. Our tuition per semester encompasses both the master's degree and the internship. So our tuition takes care of both fees, the master's program and the cost of the internship. What can I tell you a little bit more about Keiser? Is one of the strongest and most important aspects of our program is the Keiser philosophy of students first. What that means is from the very beginning of your first inquiry with our program, you have a dedicated admissions counselor who is there to help and guide you through answering questions or through the graduate application process. You will also, if needed, have a dedicated financial aid officer who can talk with you about financial aid as well as scholarships that are available. But you also have a dedicated faculty, a faculty that care about our profession and are there to mentor and nurture you through this program. As I said, our program is 1 year, which means it is a rigorous program requiring the student to be motivated as well as self-directed towards succeeding in this 1 year program. As a dietetic internship, we do participate with DICAS. We have 2 start dates for our program. If you participate in the spring match, you would begin in August. If you participate with fall match, you would begin in January. So our start dates are August and January, and a year later, you will have graduated from the program. Being that we are 1 year, students complete the program in 3 semesters. Our semesters are 16 weeks long with 2 terms. What that means is you have a term A and a term C that you will be taking courses and also participating in the internship. And those terms, term A, term C, are 8 weeks long. As I said, we are a distance internship. Being that we are a little longer in our internship hours, we are 1,320 supervised practice hours. And if you're thinking, why so long? Think about it, your distance. I have had 3 students from Hawaii. As much as I'd like to do a site visit, I just haven't been able to get to Hawaii yet. So what I have to do is make sure as you go through your rotations, you are able to get the knowledge and skills needed to prepare you for entry-level practice. So because of that, we do have a longer supervised practice hours. Those hours are easily completed within the year, often allowing students about 2.5 months of time when they're only taking the didactic courses. When we look at that 1,320 hours, we break it down into 640 supervised practice hours in clinical, that is 16 weeks, 520 hours of supervised practice in community, that's 13 weeks, and 160 supervised practice hours in food service, that's 4 weeks. It's pretty much how the program breaks down. But it doesn't mean you're doing all your clinical at one time. Remember, you're going out looking for preceptors. So the availability of the preceptors is very important. So some students may start out and do half their hours of community, move to food service, go back to a second community rotation, and then begin to complete their clinical rotation. Some students do 3 different sites in clinical. We do require a minimum of 8 weeks of hospital. If a preceptor will do longer, we always say thank you, go back to your car and do your happy dance, because the more clinical hours that you can get, really, it is best for you. Some students break it down into long-term care. Others like to work at dialysis center, diabetes center, cancer center. So we're very flexible in helping you design your supervised practice experience. Of course, food service can be hospital, rehabilitation. It can be community with a feeding center, as well as it can be a school district. On our webpage, the student handbook gives examples of different types of sites that you could begin to reach out to talk to about putting your rotation schedule together. And on our webpage, under cohort schedule, you'll see an example of what a schedule could look like. And it gives you also the breakdown of the types of information that we need for you to provide for us so we can make contact. Now, at this point, you're probably thinking, how do I find preceptors? Now, that's got to be hard to do. Let me go back and tell you a little bit about me. Back many, many years ago, when I was doing my internship, I did exactly this type of program. It wasn't called distant learning, but I did a master's 6-month work experience. And that work experience was the internship. And I had to find my preceptors. So I kind of sort of know how you're feeling. But back many, many years ago when I was doing this, the preceptors weren't used to students approaching them. They were used to a program director or clinical coordinator. But now, distant learning internships, preceptors are very familiar with, and they're very approachable, those preceptors. So don't be afraid. But how do you find preceptors? Well, in the handbook, you will find the preceptor locator website. That's an academy website where you go in, you put your city and state, and a list of preceptors will come up in your area that are willing to precept students. Your time in your didactic program is a great way to begin to network through volunteering, through your student dietetic association, or really just calling up a facility and asking, would you be willing to precept me during my internship? If a preceptor is not familiar with what is expected of them, you can always reach out to myself or my clinical coordinator, Laura Goolsby, and we will talk to the preceptor, as well as we have a preceptor handbook that we will send to them to give them an idea of what is expected of the student, of the preceptor, and what type of assignments we are looking for during this rotation. Always willing to modify assignments if a preceptor has an idea of their own. One of your best resources is going to be the student handbook located on our website. It's going to answer many questions for you that you may have, and questions that will ease you into the idea of a distant learning internship. What about our faculty? Well, you can begin to see where our faculty have expertise. Myself, I pretty much have been management, I have done community, and I have practiced international dietetics. When I was in England, I was able to practice as an administrative dietitian in the National Health, as well as I practiced in a physician's surgery meaning clinic. And so I was able to do outpatient counseling, and I did on weekends work as a pediatric dietitian in the National Health. So I've been able to see 2 different types of healthcare, and it was a wonderful and rewarding experience. Laura Goolsby, our clinical coordinator, has a love for long-term care and medical nutrition therapy. And she worked 20 years in long-term care, but also worked in Yale, New Haven as a dietitian. We also have Dr. Dr. Copeland, who has a strong experience in nutrition therapy, community, and also international dietetics. So we are broad-based in the experiences that we bring to the program that we try to share with you. So I think I'll turn it back over to you, Dr. McKinley, and see what questions you may have.
All right. I guess before I move into the 5 questions I always ask, since we're talking about the program, how many interns do you usually take in each cycle, fall and spring?
We usually take between about 8 and 10. We can take more. We are accredited for more, but usually we have about 8 to 10 interns. So we're a small cohort able to get to know each other. We do have the students come for a week residency. That first week of the program, they come down to Fort Lauderdale and we get to know each other. We go over the different rotations. We talk about the assignments. We do spend about a day and a half reviewing tube feed, TPN calculations, practicing nutrition focused physical assessment. I'll do also a review in food service and community. We also bring in guest speakers. Because we are online, our library is online. And so the library comes in and walks the students through a very detailed orientation of our online library. We have Blackboard, which is our software learning platform, come in and walk the students through Blackboard. They practice uploading assignments, how to handle the discussion questions that they will have in each of the didactic courses. We also have other speakers come in. The writing studio is one of the best resources that we have. It is a group of faculty, mainly English faculty, where you can submit your work for their review. They're not writing your paper, but they're helping you as far as editing that paper. We use APA format, so it's a good way to begin to learn the APA formatting. And that is a resource that, believe me, I wish I had when I was going to school. It really is a wonderful way for students to learn how to improve their writing.
So how do you currently integrate RD exam review into the program?
We we use Visual Veggies as our software from day one. We encourage you to practice. First semester, term 1, practice, get used to the software, become familiar with the tools and resources. In term 2, you practice and you practice, but you are required to submit 1 full mock RD exam, and it is weighted. So you have to score 40% or higher. If you don't, you get a 0 for that assignment. In semester 2, you continue to practice. But we again, in term A, you have a weighted full mock RD exam that you need to pass. Term C, you have another full RD mock exam weighted that you need to pass. In the last semester, not only will you in term A and C submit a full weighted mock RD exam, but to graduate, you must complete 8 full mock RD exams with an 86% or higher. If you have been practicing and setting time aside and taking this software and the opportunity of practice seriously, you'll do very well. You'll do very well. And so we use Visual Veggies as our learning platform for practice RD exams.
All right, I'm going to jump into the 5 questions that I ask all programs that come on the podcast. And these questions were put together with the help of my students to make sure I was asking the questions they wanted the answers to. So my first question is, what is one thing in particular that you just really love to see in an applicant's personal statement?
Passion for dietetics. What I don't want to hear is their family history about grandma and her diabetes. I want to walk away when I put that personal statement down that they really have a genuine interest for dietetics, whatever area they want to go into, whether it's clinical, management, sports, food service, retail. But I walk away with the sense, yep, this is what they want to do. So that's what I'm looking for in the personal statement. We do limit our personal statement to 1,000 words.
So when thinking about resumes, true or false, an applicant's resume should be 1 page and 1 page only. Either way, why?
I'm going to quantify that if I can. Usually resumes do come to us 1 page, but if you are a second career student coming back, or you have been working, you have transferable skills that cross from what you're doing into dietetics. And you very well may want to highlight those skills that may take you into a second page. And that's okay, but make sure the information is telling us about you and that, yes, you recognize these skill sets that you have are also transferable to dietetics and nutrition. So 1, yes, we get. 2, I'm not opposed to.
All right. So my third question is my favorite question to ask directors. So what is one or more things that an applicant may do, and this could be in contact before they apply, something in their application that maybe raises a red flag for you, and you would think maybe this applicant isn't the best fit for this program?
Well, if we're talking about, if they're talking to us ahead of time, they need to really think about how they're presenting themselves. I'm kind of a stickler about presentations. And when my students do presentation, I actually count the ums, the you knows, the yes, and that talks about your oral skills. And of course, you're going to be developing that through the internship, but you want to give us a positive presentation, having your questions available, having them written down if you're talking to us, or through an email. We don't mind if you list your questions. We'd be more than happy to answer them. We do look at, when the computer highlights or underlines a word, check your spelling, check your grammar. All of that is how we are looking at how your written communication is going to be. I like a student who will ask a question. I don't have a problem with that. I don't have a problem if a student would email us and say, most students call me Dr. D. Dr. D, is this a possible site that I could use? And we'll take a look at that site and get back with you about it. We are also willing to talk to your preceptors ahead of time. So present yourself positively to us. Putting that application and putting that rotation together is a new experience, and we're here to help you with that.
All right. So my fourth question, what is one aspect of the program that you really feel separates you from the competition?
Well, I think our strongest uniqueness is that we are a master's internship in 1 year. That really separates us from other programs. The other area that makes us unique is that Keiser student first philosophy. Everyone at Keiser University that you're going to interact with wants to see you succeed. And we're here to help you from your first inquiry to talking to the MSDI faculty. Students will reach out to us even before they begin to talk to the admissions counselors, and that's fine. We're here to help you. And I've helped many students that may not necessarily be looking at our program, but found my email. And if I can help you, I will. I will do that.
All right. So my last question of the 5 is a 2-parter. So the first part, what would be the 3 best adjectives or descriptors or phrases, whatever you have, that you feel best describes your program?
Well, rigorous. It is a rigorous program. To complete all that needs to be completed, remember each term you're taking one didactic course and you're taking what we call an advanced practice course, and that's the internship. And you do have assignments in both of those. So it's pretty rigorous. I think the commitment of faculty and everyone that you interact with is so important and separates us. And again, that student first. We are here to help you succeed. Okay, what's the second part?
Very similar. 3 adjectives, descriptors, or phrases to describe your ideal applicant.
Again, dedication, commitment, passion to dietetics and nutrition. Self-motivated, self-directed individuals certainly succeed better in our program. And the importance of time management, because you are going to be out. We are a full-time program, so you're out in the rotations 40 hours a week. And seeing that, you're going to be then having a didactic course that you're going to be taking during that term. So you'll be meeting with your professor 1 or 2 nights through what we call Keiser Live, which is our discussion board. You will have assignments that need to be submitted. So learning those time management skills is very helpful.
All right. Well, that was all the questions I had. So to close out this episode, I would love for you to give our viewers a little take-home message if there are any potential applicants watching.
My take-home message is I have never once regretted being a dietitian. I love my profession. I may not always like the position, but that's different than not loving my profession. And I find it a privilege to be able to show my dedication and commitment to dietetics to the future of our profession. And I get excited every new cohort.
All right. Well, thank you so much, Donna, for being on this episode, your very first podcast, which you did a really great job.
Thank you.
So for those at home who would like some more information on the program with Keiser and to get in touch with Donna, I've put the website address in the description below this video. And as always, don't forget to like this video and subscribe so you never miss an episode with another awesome dietetic internship. And we'll see you next time.
And thank you very much. And to everyone who's listening, I wish them the best.
Yeah, you made it. Donna's first podcast.